Okay, I'm going to gather all of my equipment: stethoscope, ophthalmoscope, otoscope, pen light, cotton ball, tongue blade, etc. I'm going to provide patient privacy and hand hygiene. Hey, my name is Emily. I'm going to be doing a head-to-toe assessment on you today. Can I please get your name and date of birth?
Chase, 5/28/1992.
Okay, perfect, Chase. So throughout today's exam, I'm going to be making you perform some movements, listening to some sounds, and palpating your skin. Throughout the assessment, if you know any tenderness or pain, please let me know, okay? I know I've already asked your name and date of birth, but can you tell me what today is?
June 23rd,
And the year?
2025.
Perfect, and where are we at? And why are you here?
To get a head-to-toe assessment.
Okay, perfect. Patient is alert and oriented. By the general appearance of the patient appears to be well nourished and no acute distress. Their posture is comfortable and upright. The patient is appropriately dressed for the situation with no foul odors. There's no visible ticks or tremors on the patient, and there's also no obvious signs of varicosities, bruising, abrasions, or lesions visible currently on the patient. Moving on, we got the vitals ahead of time. All of your vitals are perfect and within normal limits, so we will move on from that. Next, we're just going to look at the patient's skin. Looking at the patient's skin, it is appropriate for ethnicity. It is tan. There is no pallor, cyanosis, or erythema present. I'm just going to go ahead and take a look. It looks like on both arms, the hair is evenly distributed throughout the patient's arms, which is appropriate for the patient, and also the patient appears to be their stated age. Looking at the hands, I'm going to look at both of them. Checking skin turgor on both. It shows that the patient is adequately hydrated. The nail bed is firm. There's no brittle. There's no clubbing. The capillary refill is less than 3 seconds. In both hands, the nail bed is a translucent with a light pink color. No cyanosis, no edema noted in the arms or hands. Moving on, we're going to take a look at the head. The patient's head is normocephalic. It appears round with no abrasions, lesions, or lumps. So now I'm just going to go ahead and palpate your head, okay? Any tenderness? No tenderness noted. Looking throughout the patient's scalp, the hair is straight and coarse. The scalp is white. There is no dandruff noted. There is no lesions. There's no infestation or bumps noted or nodules on the head. Moving on from the head, we're going to look at the patient's eyes. Their eyes appear to be symmetrical and intact with no discharge, swelling, or redness. The eyebrows are both intact and symmetrical. They both align to the outer canthus of the eye. Eyelashes are intact as well. The eyelids cover the iris but not the pupil, which is to be expected. There is no drainage noted. I am going to go ahead and take a look at your eyes. Looking at the eyes, the sclera is white, conjunctiva is pink. There is no jaundice noted or redness of the eyes. The lens is clear as well. Moving on, I'm going to go ahead, if you can just look straight for me and check your pupils. Pupils are round, reactive to light, and accommodating. They are 3 millimeter plus, and they are both equal bilaterally. I'm also going to use my ophthalmoscope to check the patient's red reflex at this time. Red reflex is present in both eyes bilaterally. Next, I'm going to just palpate your lacrimal duct. Please let me know if there's any tenderness. Any tenderness? I'm going to also go ahead and palpate the frontal and maxillary sinuses. Any tenderness noted? Nope. I'm also going to go ahead and continue palpating and feel for all lymph nodes at this time. And let me know if you know any tenderness in any of these lymph nodes. Any tenderness so far? Good. Now we're going to go down to the deep cervical. Still no tenderness? Okay. No tenderness noted on any of the cervical lymph nodes. Next, we are going to test for cranial nerve 2, the optic nerve. We will use the Rosenberg-Snelling chart. If you can just please read to me the lowest line covering one eye, please.
CBFC.
Okay, perfect, and switch.
CBFC.
Perfect. The patient's vision is 20/20. Next, we would also check for peripheral vision at this time, so I'm going to go ahead and do that. Please tell me when you can't see my fingers, correct? Please tell me when you can see them. Peripheral vision is intact. Cranial nerve 2 is intact. We're also going to go ahead and test for cranial nerves 3, 4, and 6, oculomotor, trochlear, and abducens. At this point, I'm going to get you to just follow my pen light as I move it in directions, okay? Perfect. Cranial nerve 3, 4, and 6 is intact. Next, we're going to move to the nose. Looking at the nose, the septum is midline with no deviations. There appears to be no swelling or redness or lesions visible. I'm just going to take a look up your nose. Perfect. All right, the nasal mucosa is pink and moist. There was no deviation noted. Now we're going to check for nasal patency. If you can occlude one nostril, breathe out and in, and then switch. Nasal patency is perfect bilaterally. Next, we are going to test for cranial nerve 1, the olfactory. If you can close your eyes, and I'm going to put a familiar scent under your nose, please tell me the scent.
No.
Perfect. Cranial nerve 1 is intact. Moving on from the nose, we are going to go to the ears. Looking at the ears, the pinna are in line with the outer canthus of the eye. The auriculas and the mastoid and the auditory canal are the same color as the patient's skin, which is appropriate for his ethnicity. Looking at both ears, there appears to be no discharge, no cerumen visible, and no edema noted, or nodules or lesions. Next, I'm going to just palpate your ears. Let me know if there's any tenderness. No tenderness. No tenderness noted. The mastoids are appropriate size bilaterally. Next, I'm going to go ahead and take a look in your ear. I'm going to pull the ear up and back and take a look in. Perfect. And I'm using my otoscope to do this. Perfect. All right, looking at the ear, there is no redness, cerumen present. The tympanic membrane was noted as a pearly gray color, and the cone of light was noted at 5 and 7 o'clock. There was no perforations or lesions within the ears. I'm also going to go ahead and feel for your temporal pulse while we're here. Temporal pulse is a 2+ amplitude. I'm also going to move on to the mouth and jaw next. I'm going to go ahead and test for TMJ. If you can just open your mouth and close it. Jaw is easily movable. There were no aventations, clicks, or noises made. No TMJ noted. Moving on to the lips. The patient's lips are symmetrical. The lips are pink and moist. There appear to be no lesions, lumps, or cracks visible. Now we're just going to take a look in the patient's mouth. If you can open up for me. Perfect. And say ah. Stick your tongue out for me and say ah. Okay, perfect. I would use my tongue depressor to also tap on teeth here at this time. There appears to be no dental caries visible. Patient's teeth are equally spaced throughout his mouth. The mucosa is pink and moist. Same with the tongue, it is pink and moist. Hard and soft palate, again, are pink and moist with no lesions. There is no signs of thrush, no redness noted throughout. When the patient said ah, the uvula properly rose and fell, and tonsils were noted at a 1+. We're also going to go ahead and check for cranial nerves 9, the glossopharyngeal, and 10, the vagus nerve. So here we would test for the gag reflex, and we would also get the patient to go ahead and say like tight dynamite.
Like tight dynamite.
Perfect. Cranial nerves 9 and 10 are intact. Continuing with our cranial nerves on our face, we are going to test for cranial nerve 5, which is our trigemital nerve. This, I'm gonna place an object either soft or sharp on your face. If you can just tell me which it is and then the location of it, okay? Close your eyes for me, please.
Right cheek.
And is it soft or sharp?
Soft.
Okay.
Forehead soft.
Forehead soft, okay.
Left cheek.
Sharp or soft? Okay. Perfect. Cranial nerve 5 is intact. You can open your eyes. Next, we're going to test for cranial nerve 7, the facial nerve. If you can raise your eyebrows for me and then close your eyes. Smile real big. Clench your teeth. Stick your tongue out for me. Okay, perfect. Also, if we can, you can open your eyes now. Cranial nerve 7 is intact. If you can also just do your tongue from cheek to cheek, we're going to test for cranial nerve 12 here, which is the hypoglossal. Perfect. Cranial nerves are all intact. Moving on from the face, we are going to move on to the neck. The patient's neck is midline. There appears to be no enlargement of the thyroid noted. Now we are just going to palpate. You can tilt your head back for me and swallow. Perfect. And then the same thing, leaning forward. Perfect. No thyroid enlargement. The trachea is midline. The patient was able to properly swallow with his head tilted back and forward. Moving on from the neck, we are going to look at the patient's respiratory system. Looking at the patient's respiratory system, he is breathing unlabored. He has bilateral chest expansion. We are going to go ahead and take a listen. We're going to listen to you anteriorly, then posteriorly. First, we're going to listen to bronchio, bronchiovesicular, and vesicular lung sounds. No adventitious sounds noted on the breath in the front. Now we are going to go posteriorly. What I'm going to do is I'm going to get you forward, lean forward just a little bit. If you can just sit up straight a little bit for me, please. Perfect. I'm going to get you to take a deep breath in and then out. And then can you also say the word 99?
99.
Perfect. Tactile firmitis is present, equal bilaterally. Chest expansion was equal bilaterally as well. All right, now I'm going to take a listen posteriorly. Lung sounds are clear bilaterally. Moving on, we are going to go to the patient's cardiovascular system. So if you don't mind, if you can just lift your shirt up for me so I can see your chest, please. Okay, perfect. You can put your shirt down. On inspection of the patient's chest, there is no, in the pectus, there is no pectus excavatum. There is also no pectus carnatum noted. It is within normal limits. There was no pulsations or heavy thrills present. I'm going to go ahead and take a listen and feel around. So first I'm just going to feel, I feel the notch, suprasternal notch at the angle of Louis moving down. There is no pulsations. We are going to feel for the PMI, which is palpable, which is to be expected. Next, I'm going to take a listen. Perfect. The patient's rate is regular. There were no murmurs. S1 and S2 were noted with no gallops as well. It was at a regular rate and rhythm. Moving on, we're going to go ahead and test for cranial nerve 11. That is just going to be a shoulder shrug, if you can do that for me. Perfect. While we're still sitting, we're going to do a few range of motions and pulses. So if you can turn your head that way, I'm going to look at your neck, test the strength, Look for any JVD. Also listen for any brueries possible. No JVD noted. Turn your head back and push against my hand. Perfect. Now we're gonna go to the other side. No brueries. No JVD noted. Patient has full range of motion of the neck. I'm also gonna feel for your carotid pulses here. Perfect. Carotid pulses are noted at a 2+. Moving on, we're going to go ahead and feel for our brachial pulse. Perfect. Radial. Perfect. All were bilaterally equal at a 2+. We're going to go ahead and do our range of motion of our arms and legs and wrists. So we'll start with our shoulders. If we can go up with our shoulders all the way. Perfect. And down, straight in front of us, and then up, back down, and then can you bend our elbows for us? Perfect. And then put your arms straight back out again. Straight. Push down on me and push up. Okay, perfect. Patient has full range of motion of shoulders and elbows. Let's do our wrist. Full range of motion in our wrist as well, and elbows. Muscle strength has been noted 5 out of 5 on all of this. We're going to go ahead and continue feeling for our pulses. So we're going to do our popliteal, our posterior tibialis, and our dorsal pedis, all at a 2+ amplitude. Okay, next we're going to check for range of motion on our knees and ankles. If you can just kick both of your knees out and back in, perfect. Same thing with that one. And can you roll your ankles around for me? Perfect. Slight crepitus of the right ankle noted on it. Good. All right, next if you can use your hands and push down, or feet and push down, pull up. Muscle strength is 5 out of 5. All right. Moving on from all of that, we are going to go ahead and start with the patient's abdomen. We are going to have him lay down on the table and inspect the abdomen. Okay, moving on to the patient's abdomen. Upon inspection, there are no scars, bruises, lesions, or visible striae present. The abdomen is symmetrical with no distension. The umbilicus is midline and inverted. The contour is slightly rounded, but there are no visible venous networks noted. Next, we are going to go ahead and take a listen. It also looks like there's no muscle separation as well, or masses visible. So we're going to go ahead and take a listen. Perfect. Bowel sounds are present in all quadrants. Next, we are going to listen to make sure there are no brueries. No aortic, renal, iliac, or femoral brueries present. Next, we are going to do some percussion. Next, I'm going to go ahead and get you to take a deep breath in and out. Okay. There's tympany over most of the abdomen. However, there was dullness over the liver and spleen. The liver is palpable. However, the inferior border of the liver is palpable. However, the spleen is not. There's no muscle guarding. There's no tenderness. No large masses noted upon palpation. No rebound tenderness. Okay, moving on, we're going to look at the patient's legs. Upon inspection of the legs, there is hair which is appropriate for the patient's age and gender. We have already looked at the patient's pulses, so we're going to go ahead and have him sit up for us. Okay, now that the patient's back up, we're going to test for reflexes. We're going to do the radiobrachial, the bicep and triceps. Bilaterally, we're going to do the patella and Achilles. Perfect. Moving on, same thing on each side. Radiobrachial. Reflexes are equal bilaterally at a 2+. Next, we're going to go ahead and test some alternating motions. If you can do this for me. Perfect. Next, I'm going to have you follow your finger to your nose and touch my finger. Perfect. Moving on, we're going to go ahead and have the patient stand up. We're going to test for the spine, full range of motion of the spine. The spine shows no curvature. Let's back the camera up. No curvature of the spine. If you can bend forward for me and back up. And then can you move your side to side? Perfect. Full range of motion. We're going to go ahead and test your hip range of motion. If you can just face this way and then practice opening your hips up. Perfect. Full range of motion of the hips. Next, we're going to test your walk. If you can just walk for me, and then this, when you come back, if you can go heel to toe. Come back and go heel to toe for me. Perfect. Stop. Next, I'm going to get you to stand at baseline. Perfect. And then we are going to go ahead and get you to close your eyes. Perfect. Romberg test was negative, which is to be expected. Do you have any questions for me? That has completed your exam.
Nope.
Thank you.